You've heard from the governor that the end is near for COVID health restrictions, but you might also be wondering what that really means for you, for your family. Dr. Ian Gonzenhauser, the Chief Quality and Patient Safety Officer at Ohio State's Wexner Medical Center, is here this morning. And we have a lot of questions, Dr. Ian, so we're going to get right in there and start with this one.
Good morning. Let's go.
Yes. Based on the current trends in case numbers, will our state be in a place where these restrictions should be lifted on June 2nd?
Yeah, I think that's kind of the million-dollar question. I think we're feeling that we're moving really quickly in that direction, and this is a safe time to start making this decision. This has to happen at some point, kind of have to rip the Band-Aid off. Obviously, the longer we wait, the lower those risks become, but it gets to a point where the risk is low enough that waiting longer isn't really going to gain us that much more safety. And now's the time to consider this, and in a handful of weeks when this goes into effect, we should be in pretty good shape.
So is there a statistic or some marker that you as a scientist think we should be paying attention to as it relates to reopening?
Yeah, probably the most critical marker is looking at the cases per 100,000 individuals in the community. And the number that we're looking for is about 100 cases per 100,000. That's when we shift into much lower risk than where we've been in the past. And we're heading really quickly towards that number.
And then what is your advice on mask wearing for vaccinated people if it's no longer required, say, inside the grocery store? Is it still a sort of best practice to wear a mask?
Yeah, I think this is going to come down to a personal choice. There are still safety gains that you can make by wearing a mask. You can certainly help protect those around you in the community. But once the mandate is lifted, that's going to be up to every individual. For those who want to be more cautious and want to continue having a little bit of extra precaution, keep that mask on. There's no reason not to.
All right. Now, most of our kids are going to be out of class for the summer break when this mandate is lifted. But parents who have younger unvaccinated children could still have some concerns. What would you say to them about masks?
Yeah, I'd say that, in those cases, again, it's a personal choice. If you feel that it's need to add a little bit of extra safety and your kids are willing to keep the mask on, they can continue masking. I think there's concerns about stigma that might happen for those who want to continue, that they're being overly cautious, but that's a personal choice, and I think there's nothing wrong with continuing it. It does add a little bit of protection, so it's certainly a wise choice if you feel like you want to make it.
Dr. Gonzenhauser, we have certainly appreciated having you on our team since this started. Can you think about how far we've come in the pandemic? What are your thoughts on that?
Yeah, we've come a long way. So much has happened in the last year. I think we're all going to be unpacking the events of the last year and our personal experience for a long time to come. We've done a lot. We've accomplished a lot, and we've certainly gotten far, far through the big, risky moments of all of this. And it's a point now where we can comfortably start returning things to normal.
All right. Dr. Ian Gonzenhauser joining us. He is with the Ohio State University Wexner Medical Center. Thank you so much for your expertise.